Dr. Pavithra PANNERSELVAM. She will speak on 3D visualization of visual field, enhancing understanding with the hill of vision.
Good afternoon, everyone. I'm here to talk on the 3D visualization of the visual fields, enhancing its understanding in the hill of vision. So, practical sessions facilitates teaching, critical thinking, and coping skills, especially among the ophthalmic neophytes. We have printed complex 3D models pertaining to ophthalmology, such as circle of Willis, cerebral venous system, eyeball models, to facilitate the learning among the ophthalmic neophytes residents through the tactile 3D puzzle assembly. So, to further enhance the understanding of hill of vision, we made a 3D model out of it, which helps in easy understanding of the complex visual field effect. So, these models offer a detailed visualization of the visual fields, providing an invaluable insight for the doctors and the students. 3D models provide doctors with a clear visual representation of the patient's visual fields to improve their communication with their patients. For students, these models serve as an educational tool, making a complex concepts more easily accessible and comprehensible. So, basically, visual field is the island of vision in the sea of darkness. It's a three-dimensional graphical representation of the differential light sensitivity at different position in the space. So, we consider eye as a cone. Here we consider it as a cone, and in that cone, while viewing from the topmost portion, we can see the 2D representation of a 3D cone. So, we visualize the same with the visual field here. This is the superior portion is a 3D representation, and from the top view we can see the 2D representation of the 3D visual field. So we started this with the drawing the visual hill of vision, where the x and the y axis will represent the spatial extent of the visual field using the radial coordinates, and the z axis will represent the sensitivity to the light. So, we initially started with the sensitivity threshold at one particular location, and we go about the different location, and finally we found the sensitivity threshold at all the locations, and we drew the hill of vision. So, this is how a normal hill of vision represents. For a normal eye in a typical daylight illumination, the sensitivity is highest in the central area and decreases gradually towards the periphery. So, we used a software named Maya LT software to create this 3D model, and following it you use a Cura software which is a slicing software to print these 3D models in sliced layers. So, this Cura will give the output in the form of SLT, which is standard tessellation language, which is needed for the 3D printing. After which we used a material named the polylactic acid, which is biodegradable plastic manufactured from cornstarch, cassava, and the sugarcane waste. So, here is how the 3D model is being created. From a sphere we made it as a dome, and later we make it as an hill of vision, constructing the superior and the inferior field. So, this is how the 3D hill of vision is made. So, these are the steps, and this is how a normal hill of vision looks. So, here we have the model here, which is the final output of what we have created. This is a normal visual field, where the center portion will have the highest light sensitivity, and it decreases gradually towards the periphery. So, similarly, we made a pathological hill of vision as well, which shows the abnormal light sensitivity altered and in a altered hill of vision. Similarly, we created in the 3D model from a normal hill of vision, we created scotomas, visual field defects, and this is how an arcuate scotoma looks like. So, we have a defect which shows the scotoma here, and this is the real time video of what we have created. We have the model here. This is representing the superior arcuate scotoma, and we also have a quadranopia which shows the portion of what a superior quadrant is being defective, and we also have an isopter contraction which shows the universal decrease in the light sensitivity. So, this is how we created all the models out of the 3D printing, and this is showing the prototypes of the model which we have made till now. We also made a 3D model of circle of Willis. This is how the final model looks, and the cerebral venous and the dural sinuses. We also have a model of 3D model of eyeball, which segregates each and every layer for the better understanding of the neophytes. So finally concluding, 3D printing is perfectly suited for creating complex 3D puzzles in a cost-effective manner, making it ideal for the rapid prototyping. So 3D visualization deepens our understanding of visual field, illustrating how sensitivity of light changes across different areas. This innovative approach not only aids in education and diagnosis, but it also contributes to the better patient understanding and the treatment of the visual disorders. Thank you.
Very good presentation. Nice content. What is it more effective for education or for clinical management of the patient?
Sir, it's useful for both, sir. First, initially for the patient understanding, to make them know about the importance of glaucoma, we can have a good patient-doctor relationship, sir, so that they can understand how glaucoma causes this scotoma. So we can enhance their medical compliances. And in case of students, those don't have that idea of how the visual field looks, so this will have a better understanding, helps them to understand better what the visual field looks and how each stage of glaucoma is being proceeded. So we made it as a prototype model. We are just making other visual field defect model also.
Can it be used and this can be applied for diagnostic purposes? Like can we assess it in each and every patient, like we get a model on the computer screen with the according to the threshold sensitivity the patient clears?
Yes, ma'am.
And then we can make it like this?
Yes, ma'am. Yes, ma'am. We can do that.
But
Okay, thank you very much.
Ma'am, this is a prototype model we have made now. It's about 500 rupees each model. When we made it as a now bulk manufacturing, maybe the cost can be reduced as. Ma'am, it takes around 4 hours for a model to be printed.
initially you will make it on the screen, like for that.
Yes, ma'am. We'll make it in the software, and from the
and then
software we are printing it as models.
Printing it out in the form it is.